Solea is a laser, and it's a soft and hard tissue laser, which is phenomenal for our practice. And I have to be honest, when Dr. Aadland decided to bring it in, we were a little worried. It was different, it was a change. We're pretty good at what we do. So it took a while for us to really buy in. And all it really took, frankly, is the difference in how it affected kids. Kids are very dependent upon their parents to help them understand what an experience is going to be, right? That's who educates children. And we have so many adults that are very fearful of the dentist that they bring that on, and it relates to their children as well. Well, this laser is amazing for kids because typically the fear in what's going to happen when there's work done, restorative work done, is a needle because of the anesthetic and the vibration and the sound of the drill. With the Solea laser, none of the above happens. They go in, it's pretty easy to look at, it's not scary, it's great technology, so kids are pretty into technology and they're very used to it, and there's no anesthetic whatsoever. So it does a couple of different things for us. Time-wise, in the dental chair, it's a lot less time. So kids, they don't mind being here, they're missing school, they're loving that. But for adults, when we're all so busy, it's a lot less time in the chair. It is hard to trust something new and different. With us, we've had discussions earlier about what makes us different as a dental practice. We wouldn't bring something in that we truly didn't feel would benefit people. And oftentimes when people have issues with dentistry, it's not the actual work. It's what happens ahead of time. It's what happens after. It's an inconvenience. Some people want to say there's pain involved. I would tell you that here there's really not. This just changes that. So you can trust it because we trust it. I got worked on before patients were worked on. My husband was worked on. My sister is the dentist in this practice, and she worked on her family, whom she loves very much, before she would ever use it on a patient. Even though the older generation has a lot harder time embracing the new technology, truly it's the kids that make this worth the while, because oftentimes their fillings are very small and they're on their baby teeth, and so this is so non-invasive. It's not the same as getting out a drill and doing what we do with the drills. They don't even know what we're doing. It's like, oh, we need to take care of a little cavity bug in your mouth, and it's over and done with so quickly that they're like, okay, no big deal. And so we're setting the tone for the future and for them to come in and realize that dentistry doesn't have to hurt, and you don't have to always be numb, and there's just so many different things that this laser can do. I think that the advice I would give a patient, let's look at the patient side, because I happen to be one, so I can speak better to that. Sometimes new technology is scary, but in our case, in our practice, it's worth a try. If you say, I want to try it, but I'm unsure about it, we can switch directions in the middle. If we start this and it's something that our patients don't like, we'll stop, we'll pull the laser out of the room, and we'll go back to traditional dentistry. And so there's nothing to lose. It's worth a shot. It doesn't hurt. There's no pain involved whatsoever, because everybody needs something a little different. And as we spoke about before, if we're doing our job the best way possible, we're finding out what's best for each patient. Some patients might just say, you know what? I don't mind if you do it the other way. But for the patients that are afraid or have any phobias or just want in and out of here faster, this laser just does phenomenal things. And if our doctor is willing to use it on our family, then I think that it's probably a great product.